Reactive attachment disorder is a serious condition that happens when a child doesn't form healthy emotional attachments with their caregivers, usually their parents, during their early years. Think of attachment as the invisible emotional string that connects a child to their caregiver. It's what makes a baby feel safe, loved, and secure. When this attachment process is disrupted, it can lead to reactive attachment disorder. This condition typically starts before age 5, during those crucial early years when children are learning how to form relationships and trust others. Children with RAD may show an inability to seek comfort from caregivers, display minimal emotional responses, or avoid interactions altogether. These behaviors often stem from a lack of trust and safety in their early relationships. Reactive attachment disorder is a relatively rare condition, affecting less than 1% of the population. Types of reactive attachment disorder. Reactive attachment disorder is categorized into two main types. Number 1. Inhibited type. In this type, the child tends to withdraw emotionally and avoid seeking comfort, even when distressed. They may appear detached, unresponsive, or overly independent, often avoiding eye contact and physical affection. These children might seem emotionally frozen or detached, like they're watching life from behind a glass wall. Number 2. Disinhibited type. While technically now classified as a separate disorder called disinhibited social engagement disorder, it was historically considered part of RAD. In this pattern, children might be overly friendly with strangers and show no fear of unknown people, lacking the normal cautious response that helps keep children safe. Causes of reactive attachment disorder. The development of RAD is closely tied to early life experiences, particularly severe neglect or disrupted attachments. Let's explore the main causes. Number 1. Neglect. Severe neglect during infancy or early childhood is the primary cause. This isn't about occasional parental mistakes. We're talking about persistent patterns where a child's basic emotional and often physical needs aren't met. This may include unmet needs for food, comfort, and affection. Number 2. Frequent changes in caregivers. Frequent changes in primary caregivers, such as moving between multiple foster homes or experiencing prolonged institutional care, can prevent the formation of stable attachments. Number 3. Abuse. Physical, emotional, or sexual abuse can create a sense of fear and mistrust in caregivers, disrupting the formation of healthy attachments. Number 4. Parental mental health issues. Caregivers who struggle with mental health conditions, substance abuse, or severe stress may be unable to provide the emotional stability and attention a child needs. Number 5. Separation. Extended separation from primary caregivers during critical developmental periods, such as lengthy hospitalizations or parental imprisonment. Symptoms of reactive attachment disorder. The experience of RAD affects every aspect of a child's emotional and social life. Children with RAD often feel deeply unsafe in the world, even when they're in safe situations. They might feel constant anxiety, like they're always waiting for something bad to happen. Their emotional world is often confusing and overwhelming. These children typically struggle to understand or express their feelings. They might feel intense anger or sadness, but not know why or how to handle these emotions. Many feel a deep sense of shame or worthlessness, believing they're fundamentally unlovable. They might experience a constant internal conflict, desperately wanting close relationships while simultaneously feeling terrified of them. In social situations, they might feel like outsiders, watching others connect easily while they struggle to understand the unwritten rules of relationships. Some children might feel like they're playing a part, mimicking normal social behaviors without actually feeling the emotional connection behind them. The symptoms manifest in various ways. These children might rarely smile or seek comfort when distressed. They might not respond to affection or respond in strange ways, like stiffening when hugged. Some might avoid eye contact or physical touch altogether. They might show unexplained irritability, sadness, or fearfulness. Some children might fail to ask for support when they need it or have difficulty being soothed when upset. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of reactive attachment disorder. Diagnosing RAD requires careful observation and assessment by mental health professionals. It's not a quick or simple process, as many symptoms can overlap with other conditions. Professionals typically look for a detailed history of the child's early life experiences and care patterns, observation of the child's behavior in various settings, interviews with caregivers and other significant adults in the child's life, assessment of the child's current living situation and relationships. The diagnosis must confirm that the child has experienced severe social neglect or disrupted attachments, and that these experiences are linked to their current symptoms. Professionals will also rule out other conditions that might explain the symptoms, such as autism spectrum disorder or developmental delays. Treatment for reactive attachment disorder. The goal of treatment is to create a stable, nurturing environment where the child feels safe and supported. While there is no one-size-fits-all solution, the following approaches are often effective. Number 1. Therapeutic interventions. Attachment-based therapy is usually the foundation of treatment. This involves working with both the child and their caregivers to create secure, healthy relationships. The therapist helps caregivers understand and respond appropriately to the child's needs while helping the child learn to trust and accept care. Play therapy can also be particularly effective for younger children. Through play, children can express their feelings and learn new ways of relating to others in a safe environment. Number 2. Parent training and support. Caregivers are essential partners in the treatment process. Training programs can teach parents how to respond to the child's needs with patience and consistency, even in the face of challenging behaviors. Support groups for caregivers can provide valuable advice and emotional reassurance. Number 3. Stable home environment. Creating a predictable and nurturing environment is crucial. Consistent routines, clear boundaries, and positive reinforcement help children feel secure and reduce anxiety. Number 4. School support. Children with RAD may struggle academically or socially. So, collaborating with teachers and school counselors ensures that the child's emotional and educational needs are met in the classroom. Practical tips for caregivers. Caring for a child with RAD can be both challenging and rewarding. Here are some actionable tips to help support your child's growth and healing. Number 1. Stay calm during outbursts. Reacting calmly to emotional outbursts teaches the child that you are a stable and reliable source of support. Your calm presence also helps the child learn to regulate their own emotions. Number 2. Be patient and consistent. Building trust takes time. Respond to the child's needs consistently, even when their behavior is difficult. Number 3. Let them feel in control. Provide opportunities for the child to feel in control in appropriate ways, like letting them choose between 2 acceptable options. Number 4. Celebrate progress. Use positive reinforcement consistently. Notice and comment on positive behaviors, no matter how small. At the end, while RAD presents significant challenges, many children show improvement with appropriate treatment and support. The journey to healing takes time, and progress often happens in small steps rather than dramatic changes. The key is maintaining hope while being realistic about the time and effort required for healing. Now, we want to hear from you. Have you or someone you know care for a child with reactive attachment disorder? What strategies or resources made the biggest difference in building trust and connection? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.